We do start this evening with an Ebola scare in Oklahoma City. Deaconess Hospital monitored a patient overnight who had Ebola-like symptoms.
Well, later today, hospital administrators released a statement which reads in part, following a careful and thorough review of the patient's symptoms, risk factors, and test results, the Department of Health and the CDC have determined the patient has not been exposed to Ebola.
And even with that good news, the incident points to the need for hospitals to be prepared for Ebola cases. Deaconess apparently was, and others also claim to be. News 9's Lisa Monahan visited Integra Southwest today to see for herself.
Emergency rooms like this one are on high alert. Administrators here at Southwest Medical Center say they are prepared if an Ebola patient walks through the doors. James DeHaven, disaster specialist for Integris Hospitals, began devising a plan 5 weeks ago. When a patient with a suspected case of the Ebola virus walks in, the screening process begins.
They will ask them, have you traveled outside the United States in 21 days? If the answer is yes, at that point they will be put into isolation.
DeHaven says the hospital is currently equipped to handle 5 patients at a time, but could handle more if need be.
We could actually take an entire floor and isolate them, and each floor would hold about 30 patients. So we've prepared for that, we've practiced for it. We just hope it stays at 1 or 2.
State health officials are not worried about an outbreak. The Center for Disease Control, or CDC, has recommended protocol for hospitals. If the screening process determines the patient may have Ebola, that triggers other measures. These hazmat suits have to be worn by all hospital staff potentially coming into contact with the patient, protecting them from being exposed to the virus. The staff, covered head to toe, will then assess the symptoms of the patient and consider other risk exposures, like direct contact with someone who is ill and had been in West Africa. And because the disease is transferred by bodily fluids, DeHaven says there are also steps to minimize the chances of the virus being spread.
The chances of contracting the virus is just almost zero. Maybe not zero, but pretty close to zero.
At Southwest Medical Center, Lisa Monahan, News 9.
Integris has 7 hospitals. Southwest Medical Center is contracted with the CDC to accept any infectious patients from the airport. From state epidemiologist Dr. Christy Bradley, health officials will consider symptoms, travel history, and other risk exposures like direct contact with someone who is ill when they screen for patients with Ebola. The state health department would also consider testing patients for Ebola who may be exhibiting symptoms. They might be reporting that they've been into another country, maybe they've been in another country or had some symptoms or a direct contact with somebody that had been ill. We're also hearing today from Governor Mary Fallon. Alex.
Yes, she was quick to send out a statement regarding the Ebola threat at Deaconess. She said, in part, hospitals coordinated with the Oklahoma State Department of Health and the Center for Disease Control to ensure all proper protocols and safety precautions were followed. Should this have been Ebola, the disease would have been properly isolated and treated.